Hello, good afternoon once again. And thanks for those who joined earlier, for us to be patient for other colleagues to join in. However, we realize that we have 4 on call right now, and we are hoping the other 10 to 12 will join us as soon as we can, so that together we can all go through this orientation on the WHO regional assessment of cardiometabolic medicines, diagnostics, and technologies. But of course, we will go through with the agenda that we actually shared on the platform for us to look at. However, before we begin, can we just have a short word of prayer, and then we can project the agenda for us to all look at, and then we continue. Yes, so can we have? All right, so I think I'll just do the continue. Father, we thank you for this afternoon. We thank you for the opportunity to gather together, even as regional heads of pharmaceutical services. As we go through this orientation, we pray that, Lord, understanding will come. We pray that we'll be able to appreciate that which we are going to learn, and we'll have fruitful discussions in Jesus' name. Amen.
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 Yes, so before we continue, yes, please, this is how the agenda actually looks like. But before we continue with the items on the agenda, can we actually identify ourselves, introduce ourselves, and from which region we are coming from, so that we know who is on the call today? Thank you very much.
Okay.
Hello, good morning.
Good morning.
Good morning.
I'm Rita. I also don't call from Eastern Region.
Thank you very much, Auntie Rita. Glad to have you. Please, the next person, please.
Good afternoon.
Good
Please, my name is Isa Seidu. I'm representing Western Regional Chief Pharmacist. He couldn't come, so I'm the RMS manager.
All right. Yeah. Thank you very much for making it. Welcome. Next, please. Madam Dinah, please go ahead and introduce yourself.
Good afternoon.
Chief Dana, please, you can go ahead and introduce yourself.
All right, so from the office, we have
Dr. Emmanuel Owusu.
Yes, and I'm Claudette Diogo, and then we have Director of Pharmaceutical Services, who will go ahead to give us some brief remarks for us to start the ball rolling. Director, kindly.
All right, thank you. Good afternoon to us all.
Good afternoon.
Good afternoon to us. All those on the call, good afternoon. I want to hear our voice, please. Hello, good afternoon. Please, can you hear me? Can I be heard?
Yes, Senator Dominic, we can hear you. Good afternoon, sir.
All right. We want to be sure that those who are on the call are really listening. Ike, are you listening to us? Can you hear me? Chief Dinah Winnie, please, can you hear me? All right. Mickey Ewaba, Western, no, please, can you hear? Chief Boku Ashanti, please, can you hear? All right, so on behalf of the Director General of the service, I would want to welcome all of us to this short orientation meeting for the upcoming exercise for the country. Somewhere at the beginning of this year, the Director General of Ghana Health Service decided to designate the Office of the Director of Pharmaceutical Service to serve as the focal point for the assessment of the availability, accessibility, affordability of essential medicines, diagnostics, and health technologies for cardiovascular disease and diabetes in the Africa region by WHO. But this is a very critical national exercise in the sense that we are all aware that currently there is growing concern about the rise of NCDs, especially in developing countries. And for this service to serve as the focal point for this national exercise, for me, it was an honor and great confidence that was reposed in us. The reason being that various divisions could have been designated to serve as the focal point for this critical national exercise. Of course, we all know that at Ghana Health Service, we have the NCD program under the Public Health Division. We also have Institutional Care Division and SSDM. All these divisions could have been designated. But for one reason or the other, the Director General, based on his own wisdom, decided to choose us to serve in this capacity. And for me, it faced an opportunity that we must take full advantage of in order to justify the confidence that he has reposed in us. Now, the assessment includes 3 key components, which I want to run us through. It has 3 pillars. The first pillar had to do with facility level service using an app-based tool to collect data on price and availability in public and private health facilities. The second pillar was procurement analysis to gather contextual information on health systems and national procurement prices. The third was price component tracking to examine the breakdown of medicines cost across the supply chain. Interestingly, as a service, we've been able to work on the second pillar, which is procurement analysis to gather contextual information on health systems and national procurement prices. And that was the first phase. We are now moving on to the second phase, which consists of facility level service using an app-based tool to collect data on price and availability in public and private health facilities. Together, it is expected that these elements would provide a comprehensive understanding of both health level access and systemic bottlenecks affecting supply and policy of medicines used in managing cardiovascular conditions in the country. And like I said earlier on, the Ghana Health Service is looking up to us to get this exercise done. But we are also looking up to pharmaceutical services, especially the regional heads of pharmaceutical services, to carry out this activity. And I'm glad this afternoon that most of us, or most of the regions, made it a top priority for the itinerary for this week. And I urge all of us to attach all seriousness to this nationwide exercise. We have gentlemen here who have been trained, a gentleman and a lady here, Dr. Diogo and Dr. Yima. They are going to facilitate the entire exercise whilst I sit back and listen carefully to questions that are going to be asked and how best to address them. On that note, I want to thank all of us for making time to see through, to listen to this orientation program. Thank you very much.
Thank you
Over
very
to you,
much.
Dr. Silva.
Thank you very much, Director. We really appreciate your wise remarks, and we hope we will not disappoint the Director General on this assignment that has been given the Pharmaceutical Services Directorate as well as the whole region. We are glad to have a few more people join. Hopefully, the rest of the chiefs will join us so that we can have a very good meeting. We hope it will not drag unduly so that we can go back to our various assignments as per our schedule. So, like we shared earlier on, we've been able to receive a remark from the Director of Pharmaceutical Services. So we will go straight into the presentation, what it is all about and what is actually expected of us. And then from there, we can have questions and answer time so that we can be able to address any confusion that we have. To get this rolling, we have Dr. Emmanuel Usu to take us through the presentation, and we will be attentive and then maybe jot out our questions, and then when it is time, we can ask questions. Thank you, and over to you, Dr. Usu.
All right. Thank you, Dr. Diogo. And thank you to Director for the opportunity to do this presentation on behalf of the office. So just permit me to share my screen and then I will start with the presentation. Please, I hope I can be heard. I hope I'm audible enough. If I can get a response, I'll be glad.
Yes, please.
All right.
Yes, I can hear you, Mano.
Yes, please, we can hear
All
you.
right. Thank you. Thank you. All right. Please, can my screen be seen? Can you please see my screen, please?
Yes.
Good, good. All right. So we can start. Like my colleague said, we are going to talk about the WHO regional assessment on cardiometabolic medicines Diagnostics and Technologies. So this is going to be a training for the coordinators. That is the chief pharmacist. You are designated as the coordinators for this facility-based survey. So it's just a short training or an orientation for the survey to be conducted. So by way of agenda, we'll look at the background and then the purpose for the survey, why it matters, and Ghana's role in the survey. And we'll also talk about your role as coordinators for the survey. We'll look briefly at the facilities that have been nominated for the survey. And then we'll also look at the app, the tool we are going to use for the survey, how to access it, and how to do the setup. We'll also talk about the survey itself, conducting the interview. We'll look at the medicines that we are going to survey and the devices. We'll talk briefly about what we call the validation visits, and then we'll look at the data quality and then next steps. All right, so by way of the background and the purpose. So according to WHO, 37% of all deaths in Africa are from NCDs. 37% of all deaths in Africa are from NCDs. And also, according to the International Federation of Diabetes, 19.3 million adults are with diabetes in Africa alone. All right. And out of 106 million adults with hypertension in Africa, only 12% are controlled. If you look at these statistics, they are quite alarming. So based on these statistics, the WHO Regional Office for Africa is conducting this regional assessment to evaluate the availability, the prices, and affordability of essential medicines, diagnostics, and technologies for diabetes and cardiovascular diseases. So this assessment uses facility surveys, procurement analysis, and supply chain pricing tracking to identify barriers to access. And like we said, the data are going to be collected through phone interviews using an app that will be validated, analyzed, and then shared with us. So Ghana happens to be one of the selected countries that is participating in this landmark effort. And for the purpose of this training, we are looking at the facility-based survey, which is the final active component of this whole exercise. All right. So we look at your role as facility survey coordinators. So as coordinators, first of all, you are to brief the facility focal persons for the survey. So you are to contact each of your 12 nominated facilities, confirm the focal persons, you schedule the interview, and then you instruct them to have their stock ready, the stock to be surveyed ready. Secondly, the survey is going to be conducted using telephone interviews. So you are to call each facility, and then you enter the availability and price data directly into an app we shall be talking about called the ComCare app. And then you follow the structured guide in the app. And thirdly, you are to ensure that the data is of the highest quality. You have to ensure high data quality. And so, I mean, I'll take you through this one. In the course of the survey, you survey each as incomplete, first of all, and then you review all the entries, and then you only hit the finish button when you've confirmed that the data you surveyed is correct. And then you are to also conduct what we call the validation visits. And by the validation visits, we are talking about you physically visiting a subset of the facilities in your regional capital on the same day you do the phone call survey to verify the data accuracy. And then finally, when you are done, you report to the office at the headquarters. All right, so we are looking at total of 12 facilities per region for the survey. I think with the exception of Eastern region, we are doing 12 facilities per each region. And so the chief pharmacist for each region should kindly take note. I think we are already aware, we're involved in the selection of the facilities and then the focal persons. I don't want to go through the criteria for the selection because it's already been done already. All right. So we move on to the ComCare app, how to access it, and then the setup. All right. So there are two options to access the app. We have the credentials displayed on your screen. The username for the country Ghana is Ghana_survey, and then the password is NCD in caps, followed by 1, 2, 3, 4. If you are using the app version, you need the access code or the app code, which is also displayed, which will be shared with you. Now, the first option you have is to access the app using your web browser. And so you can go to their site, comcarehq.org, and then you can log in with the credentials provided, and then you can go ahead. And then the other option is to also download their Android app version. So you can download the app in the same vein. You enter the code, the setup code, and then you use the logins to the credentials to log in. All right. Unfortunately, there is no app for the iPhones, the iOS devices. So for those of you that would want to use your iOS devices, you can use the web browser options to access the tool to do the survey. All right. So we can go. So in conducting the survey, all right, before you conduct the survey, it is important that you open the app and then register the facility you intend to survey. All right. After doing that, you have to ensure you have the medicines list ready for reference. The medicines list shall be shared with you. The facilities, the focal persons, and then the medicines list shall be shared with you after this meeting. So make sure the medicines list is also ready as a reference. You have to confirm the focal person is a pharmacist or at least an in charge, a dispensary or a technician in charge. You also have to ensure you have a very good phone network and internet connectivity network as well, since you'll be doing some entries. But even with the connectivity, I mean, the app is said that you can enter the data offline, and anytime you have a good connectivity, it synchronizes onto their server. All right, so that's an advantage we have. And then also you have to brief the focal persons that the survey is on medicines that are in stock at the time of the survey and the prices needed. All right, so they have to understand that it is for stocks that are available on the day of the survey. Now, during the interview, you enter the data directly into the ComCare app as the focal person's response. And then you have to make sure you cover all 10 survey sessions. So when you go into the app, there are about 10 sessions, and you have to ensure you go through all the sessions. We shall look at it briefly. And then you also have to take note that for all tablets and capsules, you will record only the lowest unit price products. The lowest price unit products. So for instance, if you have, let's say, 2 brands of amlodipine and you are serving the amlodipine, you go in for the lowest unit price of the amlodipine available. Also take note that for insulin, we are recording all the types of insulin in stock. So the focal persons will have to understand that we are recording all insulin types available on the day of the survey. And if data is missing, remember to save as incomplete and then return later to complete it before you click on your finish button. And then you also ask the focal persons at the end of the survey if they have additional comments to add. In completing the survey, like I've already said, you save as incomplete first after entering all data. And then you and your monitoring managers will have to review the entries. And when you are satisfied, you click on the finish button. Because you have to understand that once you click on the finish button, you are unable to edit the data. All right. So in view of this, I would recommend, with the permission of the editor, that you can task your regional stores managers to actually do the survey so that you play a supervisory role. You do the review of the entries with them. I mean, this is a suggestion. It will help a great deal. Okay, so the next slide shows the list of the medicines and the devices you are to survey. They are not much, they are quite brief because we didn't want to make the whole exercise tedious. In fact, it was streamlined by WHO when we presented our list. So this is the list we are going to survey. I will share the Excel version with you after this meeting. All right. And then we spoke about the 10 survey sections in the app. These are the survey sessions. So the first session has to do with the cardiovascular medicines. Then you move on to the diabetes medicines, and then to the insulin. I mean, all types of the insulins. We will survey for the insulin syringes, the pen needles, move on to the blood glucose meters, glucose test strips. We'll look at the HbA1c testing in your facilities if it is done. We'll also look at the medicines for sickle cell management, and if there are any other comments, you also add the comments. Now we move on to the validation visits, like I mentioned earlier on. So what are these validation visits? It's a mandatory quality check where a data collector physically visits a facility on the same day the phone survey, and the purpose is to verify that the data provided by telephone is accurate. So these are the criteria. it is supposed to be done at the regional capital only. All right, so in doing the survey, you target a facility within your regional capital to do your validation visits. And we require 2 facilities per sector. So 2 facilities from the public sectors and then 2 from the private sectors. And we are also encouraged to choose facilities where availability of survey medicines was good. And I've mentioned already that it should be done the same day as the telephone interview. So maybe the RMS manager can do the phone interview, and maybe his or her deputy can follow up to go and do the validation visit. Right. Who does the visits? So not the same person who conducted the telephone interview. It's advisable you use a different data collector or a different monitoring manager. And then it is very critical that the facility must not be told in advance that a physical validation visit will follow. Because when we do that, it can introduce some biases in the data collected. All right. So we look at the data quality assurance and then the next steps. So 1, we have to ensure we conduct all the 12 facilities interviews in our regions, and remember to save as incomplete for the first time for review. And then you click on your finish button when you are convinced of your data. After that, you have to remember to notify the office at the headquarters that you are through with the survey. I think from there, we'll also notify the WHO team, and they also run their reviews. If there are any errors, they'll get back to us, we'll get back to you. And then after everything is done, they will push it on a dashboard, which will be shared with all of us. I mean, it will be a dashboard for the country, Ghana, which will be shared with all of us. All right. So in conclusion, and these are some critical rules I want us to remember. We have to remember that we have to record only the products with the lowest unit price in each category. And that we are not supposed to record multiple brands. So like I said, if you have 2 brands of amlodipine, you will survey the brand with the lowest unit price available. And then for insulins, we have to record all insulins in stock at the time of survey. Or, I mean, whichever way it is presented, as vials, pens, cartridges, the human analog, whatever, we are surveying all the insulins. Thirdly, you have to remember that you cannot edit data after pressing the finish button. So always save as incomplete first. You review before you click the finish button. And then for incomplete data, if waiting for a facility to provide the missing data, leave it as incomplete. Never submit with gaps. I mean, same thing. For glucose meters and for the glucose strips, we are to record meters and strips supplied to patients for home self-testing. So it looks like this one will be applicable to only the private facilities, because we don't do this at the public facilities. So we are not supposed to record facility use only items, but the ones for home self-testing alone. And then finally, remember that for the validation visits, never tell a facility in advance they will receive a validation visit, because it can introduce some biases in the data collected. On that note, thank you so much. And Ghana and the office, for that matter, is counting on your coordination to make this exercise a success. Thank you.
Thank you very much, Dr. Usu. That was very clear. We don't press finish when we are not finally done, and then we do not give any advance notice to any facility when we are going on validation visits. At this point, please, we want to open the room for any questions. If anybody has a question, kindly raise up your hands on the icon, and then please, we would hear your question, and then we will do well to answer it. However, we should take note that, yes, even though we got the list from the various chiefs, we will still send it and share with all of us so that we are abreast with the list that came from our various regions, and then we can know the facilities that we are serving, and then the list of items or commodities or medicines that we are using for the survey. At this point, the room is open for questions, please. Thank you very much, Dr. Usu, once again.
Thank you. Yes, hello, chiefs. Please, any question, any clarification from us? Okay, Chief Philip Opoku, please, you can go ahead, sir.
Okay. Thank you, boss, and good afternoon. My question is, in the first, I think I heard that the exercise will be conducted on phone before later you go there. And then even if you are going there, you don't have to inform the person. So I have two questions. One, then why do you do the phone call? Why not go there straight? And secondly, if you are going there and you are not pre-informed them, what about if you go there and the focal person is not around? How do you get the information required? Thank you. Because you don't have to.
Thank you very much. Yeah, we appreciate your question. Yes.
Claudette, I heard you.
Okay, all right. Thank you, Chief, for the question. The physical visits are just validation visits, and the purpose of that is just to validate the data we've collated, because we just want to be sure that whatever they provided to us on phone is same thing actually in stock. So that is why, per the rules, they request that you select 4 out of the 12 facilities you are surveying to do the validation visits. So the whole exercise actually is to be done on the phone, but you just use these 4 facilities to validate your data.
And as well, we also do not want to overburden the chiefs as well, considering the fact that there is really not much funds to support them. We can't let them go to all the 12 facilities. So just the 4 will do for the survey as discussed by the office with the WHO office. Yeah. Okay.
And the later part of the question. Yeah, the later part of my question is not answered. That I'm okay with the first one. That because we are not supposed to pre-inform the person, what if you go there and the focal person is not around? Because you may say that he was not aware.
The criteria is that you do it same day you conducted the phone interview. So
it's expected to be around.
Yes.
Who has given the phone response?
Yes.
That is the expectation, right?
Yes, the expectation. But then, of course, you know how we can deal with our people. We just say, oh, maybe we are passing through, but maybe they may not know we are coming to do the validation of this particular survey. And then the person will be there and then you just check it in. Yeah.
Okay, thank you.
All right, thank you very much, Uncle Phil. Please, any other questions, please? We appreciate your questions, Uncle Phil.
Okay, Chief Ewaba, please you can go ahead.
Okay, thank you very much. Unless maybe I did not hear well, you said the validation was supposed to be at the regional capital. So if you don't have the 4 facilities at the regional capital, how do you select those 4 facilities? Thank you.
Okay, so thank you very much, Chief, for that question. Yes, so from the list that was submitted, the agreement is that it has to be the 4 from the regional area. So should it happen that for a particular region you do not have 4, then it means you do not bother. You do the number up to 4 of the facilities that you have in the regional capital so that it makes it easier and accessible. Thank you very much. Hope that's okay.
Okay, all right. Mr. Sylvester, please, you can go ahead.
Thank you, sir. Please, I want a bit of clarification on the glucose meters and the strips. Are you saying that we should only record what the patient takes home, or should we not take data for the facilities once? I'm not quite sure. I don't know if you can clarify that one for me. Okay,
all right, thank you. So for the glucose meters and then the strips, WHO prefer that we survey the ones that are given to the clients to go and use in their homes. And those ones are usually done at the private facilities. For the public facilities, we usually do the testing in the facility and then we capture the data. So it is actually applicable to the private facilities that will be surveyed and not for the public facilities, because I don't think we sell glucometers at the public facilities and then strips to clients to.
However, maybe are there any new things like that happening in our various regions or facilities in our regions? I mean, we are open to hear, but I think from what we know over the period, there hasn't been, but we are open if maybe somebody has seen something similar happen in our public health facilities in our various regions. So next, I hope you're okay now.
Yes, please, I'm okay.
All right, thank you.
Yes, please, I'm
Please,
okay.
any other questions? All right. Please, any other questions, please? Are we comfortable with what we have heard? Are we good to go with the survey?
Hello.
Hi.
Hello.
Yes, Children.
Concerning the all facilities at the capital, there were some conditions, and the condition is that they should have similar data, similar thing before you can do the validation. But if in case they don't have that similar, they are all apart, completely different. What do? Do you still go ahead to validate those all facilities? Do from the public, private sector.
Unfortunately, Chief Dan, I think you were a bit muffled, so we couldn't really hear it. We heard bits and pieces, but please, can you maybe say it again? I mean, ask the question again, please. Thank you.
Saying that for the validation conditions, before you validate the 4 facilities, the speaker said it should meet certain criteria. And for instance, the data should be similar. And I'm saying that if those criteria are not met, you still go ahead and assess those facilities, the 2 from the public facility and 2 from the private facility. You go ahead.
Yes, so It is not mandatory, but I mean, it is preferred that you should go in for facilities that had very good availability from the telephone interview. But it is not mandatory that the data must be
similar or so.
yes.
Yeah. So Chief Dan, like Dr. Wusu has said, yes, it's 4. I mean, it would be great if you have 2 public, 2 private. However, if the 4 all are all public, hey, you go for it. But of course, we want a proxy where it is facilities that had very good data capture during the phone interview. But whatever it is, you are in charge, it's your region, you know better which one would make things look good for your region. So we leave it with you, but it has to be 4 from the regional capital. Thank you. Yes. Please, we have a hand up.
Yes, Claudette is Rita.
Oh, Rita.
I want to know if the presentation which has details on procedures, how to go about things, will be shared on the platform.
Yes, Rita, definitely.
And then my second concern has to do with validation. I could ask this question a bit early, but forgive me if I am. Are we to use our own means to get to the facilities where these validations are supposed to be done? Or there is some support that will enable chiefs to move out to the facilities and validate the data? Thank you.
Yeah, thank you very much. That's a very legitimate question there. I would have asked the same. But at this point, I would just want the director to answer this particular question. So
all right. Thank you, Rita, for that question. The village did promise something, about $1,000.
Just $1,000.
Yes, $1,000 for the entire exercise. And you and I know that that money is not adequate. Apart from that, it's not even in. We may ask to contact one doctor for that funds. We are having challenges contacting them. So for now, it is expected that the region will give the resources and carry out this exercise. However, if we receive that funds from the village, that $1,000 will make that money available to not $1,000 per region. The whole amount is $1,000. So we shall see how we shall disperse the national kit for everybody to get something small. Thank you.
Thank you very much, Director. And Rita, it will interest you to know that when regions even submitted the list, it's been a while now, and we are now even coming back with orientation. It's just because we have had to be fighting them to see if they can even give us something. Because Director wanted some motivation for all regions to carry out the survey. But just like he said, this is where we are, but the work has to go on. So as soon as WHO does what they have to do, I think his word would come to pass. Hope you are okay, Rita.
Yes, I'm okay.
Thank
so
you.
When Director says if the regions to support, is there going to be some form of correspondence to the regions on the support, or is it something that chief pharmacists should locally talk about with their regional heads?
So thanks for that question as well. I think letters have already been forwarded to the regional directors. They are fully aware from Director General. So let us bring those letters once again to the attention of the regions to support. Maybe after this section, we will put the letters to you because it's been sent already to the various regional directors of health services. So that is it. So please leverage on that one and speak to your regional directors. Thank you.
All right.
And we also expect, maybe let me also say this, we also expect that the regional heads of pharmaceutical services will give a detailed debriefing to the regional directors and also to the senior managers in the region, especially in the Monday morning meetings. Because this is a national exercise being conducted by the village in the sense that Gemina has sanctioned. So we expect all regional heads to give the regional directors and the senior managers a detailed debriefing on the upcoming exercise. To that effect, we are going to share the concept note of the entire process with us and also forward the letter once again to us so that we can adequately equip ourselves for that debriefing exercise. Thank you.
Thank you very much, Director. Rita, thanks so much for the excellent questions. I'm sure most of us wanted to ask the same thing, but you have saved us. Yes, please. Yeah, you have saved us. Thank you. Thank you, Director, for the responses. Please, any more questions for us, please? But as we said, we will share the presentation slides. We will share the list of facilities once again so that we remind ourselves remind ourselves of the facilities per the regions or what the regions shared, and then the medicines that we are also serving as well. And of course, please, the office is also opened if there are any clarity that we seek to have and all that, and if there are any challenges. So maybe, Yima, can you just let us, I don't see any more hands. Can we just see a bit of a demonstration of how the form looks like so that they can just look at it?
All right. Because we are on the call, I will try with the web-based. Just a second. All right, please, can my screen be seen?
Yes.
Thank you. So currently, I'm displaying the web-based version of the tool. I'll share the link to the site with you. When you open the link, you will get an interface like this where they will ask for your username and your password. And so, like I shared in the presentation, the username is Ghana_survey. And then the password is NCD in caps, NCD, and then 1234. Then you go inside. All right. So for the purposes of the survey, we would come to the WHO Afro Regional Study button. Then it opens this interface for you where you have the facility management bit and you have the facility survey. So before you conduct the facility survey, like I mentioned in the training, you have to register the facility before you go ahead. So to register the facility, you would click click on the facility management button. I may not go ahead and do it because this is a live platform. So I would want, okay, well, I can do it, then I can even remove it. Fine. So we have the registration form. You click on it. So you indicate your country, date of registration, name of facility, user ID, and then facility number. These are things you can auto-generate yourself. You indicate your region, the contact information of the focal person. So their contact details, email addresses, city, town. I mean, I think they are looking for a specific street name and things like that. You also indicate the sector, whether it's a public or the private, whatever, and then name of your currency, and then you go ahead and then you register. Right. So after registration, you can come here and then you can see the list of all the facilities you've registered to survey. And then once you've registered the facility, when you want to do the survey, you would click on the facility survey, and then you choose the facility to go ahead and then do the survey. I didn't want to go ahead and do it because this is a live platform. I don't want to interfere because whatever we do, they get the feedback there and they are monitoring. So briefly, this is how it's going to be. But of course, like Mr. Diogo said, if you start and you have any challenges, we are always available. Our doors are opened. Anytime we are ready to assist. Thank you, Doctor.
Excellent. Thank you so much, Dr. Usu. I'm sure even if he's sleeping and you call him, he will be able to help out. But for me, if I'm sleeping and you call me, I will not hear. Thank you very much, Dr. Usu, once more. So I think with that, it's clear, but however, we'll open for any other questions that has come to mind again after the short demonstration and showing us the portal, so that we will take it from there. We promise that we will close very soon, and we shouldn't go beyond 2:00. Yeah. So please, any other questions? If there aren't any, we will quickly look at the next steps on the survey, which has to do with, yes, sharing the list of facilities and the list of medicines with all of us. And if any chief is not able to locate the letter that came to the regional health directorate on it, we would be able to share that as well, so that everyone can use it as their advocacy tool to get support from their RHDs. And then we would also share. Okay, after it, I think I'll pause and then pick up your questions, please.
Yes. From that, I wanted to know who appoints the facility focal person. Is it the chief pharmacist, or are they already known? I just want to ask to get that clearer. Who appoints that facility focal person that we are going to work with?
Yes, I think it was already appointed, and then they confirmed that they wanted to participate in the survey, and all their names were actually shared by the Director General with WHO, and all these names went. So you see on the screen in the minutes, all like maybe a sketchy update of the facility contact persons, their telephone numbers and email. So for instance, you see the location, the facility type, the facility name, the region, you see where it's located, the district, the contact person, their telephone numbers and all.
I remember. Okay, thank you.
Yes, exactly. That is what I want to share, because you did it when you were in your retrospective regions. So we have to share so that you know that these are the new ones for the new regions you are in. I'm glad that you said yes, you remember. Yes, your signature was right under it. Thank you very much for the hard work, all of you. So yeah, so these are the next steps. And then of course we will share the link to the platform and then the password. And then as we said, 24/7 will be available to support as we make the inputs. Director, any news on this next steps or it's okay? And then okay.
It's okay. So this confirms the sort of operation we've made when it comes to conducting the survey. In fact, I must say that this year we've been preoccupied with preparing seriously for this upcoming survey. It's been our topmost agenda, and a lot of efforts have been put into it to ensure that it succeeds. Because for us, it's a big statement that we are making in Ghana service. Now that we are thinking of considering applying for decoupling of medicines management from SSDA, these are some of the things that we are doing. This should justify whatever proposal that we intend writing to the Director General and of course the Council. So having said that, I want to thank all of us and also thank the team, Dr. Diego, Dr. Emmanuel Usu. They belong to the pharmaceuticals and health technologies department in the office. And we are grateful to them for the effort that they are putting thus far. Before we end, there is something I want us to do. We are all aware that we've gone past half year. And as quickly as possible, we need to organize our half-year performance review meeting. So, Dr. Usu will briefly take us through the reporting format we've been using all this while. He's made some few changes to it. He's enhanced it. In fact, DJ has always said that whenever you begin something and it's not perfect, don't be worried, because that's the version 1. In everything, there's version 1, version 2, version 3, version 4. So this the version 3, isn't it? Yes, so he's going to share with us. And this is the format that we are all expected to use in compiling our half-year report. This format enables us to collect and analyze whatever data the regions generate at headquarters level. And I want to here emphasize that if we don't, anybody who does not stick to this very format that we're going to share with us will not have its report accepted at headquarters level. So let us sit down carefully. It's not too different from what we've been using all this while. Let us sit down carefully and listen attentively. If there are any corrections or any insertions or any clarifications, let him tell us before he sits down. So, Dr. Usu, please go ahead and briefly share with us the format for this year. Thank you.
Thank you, Director, for the opportunity. So like the Director said, it's not so different from what we've been doing. In fact, as an office, we've been trying to make the reporting tool as simple as possible because we don't want to burden the chief pharmacists at all. So this is one of the innovations we tried to do in order to achieve that. So it's actually a file that we will share. And then when you open the file, it opens in your browser. And then you can capture all your data in the browser. And then when you are done, you just download a PDF, a summary of the report, and then you share it with us. So it has, first of all, an overview session, which gives you a summary of pharmaceutical services and our reporting format. And then you come to the reporting region where you would choose the region you are reporting from. Let's say, let me choose Ashanti region. And then you enter your name, the date, and then your contact details, that telephone or email address. And also there's an option for you to choose the preceding year. So for instance, if you are reporting for 2026, the preceding year is 2025. So once you choose 2025, it automatically indicates that you are doing the report for 2026, and it will also reflect in the heading. Let's say if I had chosen 2024, it would have said I was reporting for 2025, it would have reflected here as well. All right. So when you are done with this information, you can now begin with your report. So it takes you to the first section that talks about the background and introduction. And the first component is your original profile component. So like we always do, you indicate the total population. You compare the preceding year to the year of reporting. So you fill the total land mass in square per kilometer. So you fill all the parameters needed, and then you move to the next session that talks about the regional challenges and then priorities. So you can list them here easily, the challenges and then the priorities. And then you move on to the next section that talks about the workforce management. So in the same vein, so you report on the category of staffs that were posted and those that were reported for the preceding year and then for the year you are reporting. So this will be for the mechanized staff. No, sorry, this is for the posting of staff. After that, we look at the staff complement where we take information for the mechanized staff. So the number required, number at post. And this time around, it does a lot of the calculations for you. For instance, if let's say you require 10 specialist pharmacists, but currently you have, let's say, 2 at post, automatically it will tell us there's a gap of 8. If you have any remarks, you add it to it. And then for the non-mechanized staff, you just indicate the number at post. And then you give us an idea of your basic salary. So let's say you have 2 at post, maybe you are giving them 1,005, blah, blah, blah. You indicate it there. I think the writer was saying it is for us to have an idea of how much is spent from the IDF on the non-mechanized staff. So that is how it's going to be going forward. And as you do, it will also calculate the total number of staff, both mechanized and non-mechanized for you automatically, and then the gaps as well. So from there, we move to the clinical session. Same. So you look at the total number of OPD visits per capita. You compare the preceding year and then the year of reports. You fill in all the parameters, and then you go to the next session. That is the pharmaceutical care session. Same, you have the indicators here. So you fill for the preceding and then the reporting year. If there are interventions, you do same. Clinical ward activities, you do same. And then you move to the next session on the patient safety and then quality improvement. All right. So same. Types of medication errors, the prescribing errors, and then the proportion, the dispensing errors, proportion, see there are remarks, you indicate the outcomes, you feel same. Source of the adverse drugs reaction. So this time we are asking for the top 6 by classification. All right. So I've been hinted. I'll do a little modification. And as I say, we should just report on the adverse drug reaction. It shouldn't be the top 6 by ATC classification. So I'll do that correction before I share with the team. All right. And then we also look at the outcomes of the adverse drug reactions in the number that occurred, recovered, not recovered yet, unknown, and all that. Then we come and do the RUM indicator survey. We compare the preceding year and the year of reporting. And then the last but one session, the pharmaceutical supply management and financing. So the framework contract purchases, the preceding year, and then the year of reporting, the non-framework. Say when you do, it automatically calculates the totals for you, the annual sales, total receipts, and all the indicators. We'll fill them. We look at the debt by facility type, same. And so this one to say, as you fill, it does the percentages for you automatically, and then the total debts too for you automatically. So when it comes to the calculations, it becomes very easy now as far as the reporting is concerned. And then there's also the bit of the analysis of the pharmaceuticals by class and value. So we are looking at the purchases spent using the ATC classification. And as you do, it does the calculations for you, the percentage spent, and then the ranking for you automatically too. You don't have to worry your head calculating everything. Working capital, same, the preceding year, the year of reporting, you add your remarks. And then I think last year we couldn't capture the expired medicines well because of the tool we used. But this time around, it is captured here clearly. The name of medicine, supplier, quantity, unit cost, the total cost will be calculated automatically, and then you indicate the expire date. If it is more than 3, you can add on. You can always add on by clicking this button. And as you do, it also calculates the total amounts of expired drugs for you automatically. All right. So from there, we come to the conclusions, and then you talk about your achievements, recommendations, and then the next steps. I've also included as the last bit a reference, the ATC referencing session, so that for when you are reporting on the ATC medicines and you are not sure which one it belongs to, you can come to this session and then come and search. So let's say I want to know where amlodipine falls as far as the ATC classification is concerned. Once you begin to type, the medicine will come. It will show you the class, the code, and then the system, and then the therapeutic class. If you take paracetamol, for instance, it shows you. If you take, let's say, lisinopril, it also shows you, and things like that to make the work easy for all of us. So once you are done, you can go ahead and then submit. When you click on the submit button, it gives you the option to download whatever you submitted as PDF. If you have a printer, you can also print it, or again save as PDF for yourself, and then you share the PDF with us as your submission of your reports. Please, I'm done.
All right, thank you. So we'll make room for questions. I have a few comments to make. We'll make room for questions first. So if there are any questions, please go ahead. All right. I think
Yes, Emmanuel. I got a bit confused at the end. When we submit the report, then it comes to you, right?
No, please.
Hello, Emmanuel.
Yeah,
Dr.
hello, Chief
Emmanuel.
Peter. Yeah, please, can you hear me? Hello.
Yes, I can.
Yes. So when you click on submit.
Hello.
Hello.
Yes, I'm here. Please.
All right. So I was saying that when you click on the submit report button, it brings you to the interface I'm currently showing. It doesn't come to us. It gives you the option to download the report as PDF. So you will download it, and then you will now share the downloaded copy with us. You can also file a copy for your records.
All right. I think, you see, this is an innovation because previously the regions did complain that when they fill the report and submit to us, they are not privileged to have copies at the end. So you have to review the whole thing just to ensure that you can download the report, the filled completed report at your end before submitting the another copy to us. So that's the novelty that he has brought into the report submission this time around, so that you can have copies at your end as well as at headquarters.
Okay.
Hello? Hello?
Hello? Yeah, nice to meet you.
Yeah, this is Dinah.
Oh, okay, yes. Chief Diana,
Yes.
please.
Are we to share the report format with the facilities?
No,
Can you hear
please.
me?
No, please. The reporting format that was just presented, no. It is for you, the chief, or whoever you have nominated to fill it in for you, please. Not the
Okay.
facilities. Yes, please.
Okay.
Thank you
All
so much.
Thank you.
Yes. So, please, it's still open. So, if you have, yes, Chief Nikki.
All right, but Dana, you see, there's also one challenge we've also realized. It looks as if the institution don't have access to the reporting format at all. We have three forms of the reporting format. We have the Word document. That is that's a full document that we expect all facilities to have access to. So that they fill the Word document and then forward it to you. Then you get an ID fellow to then fill this very well and forward this to us.
So
the Word
have the
document
Word
should be sent to
document.
them. Yes, so we'll make the Word document available to you. Because there is still you're supposed to have it and study it and understand it. So that's what I was saying. Secondly, the previous report, most regions will not report on the clinical services.
Yes.
So one observation that was made along the line at our senior managers meeting was the fact that our report focused too much on products because we couldn't basically come up with detailed whatever report on the clinical service that we render. So this time around, let us impress upon the institutions to fill the reports completely. In fact, we're going to look at the completeness and also the timeliness, because these two are also important to us.
Okay.
All right, thank you.
Okay.
Thank you.
Okay, thank you very much. I wanted to find out if you click on the submit button and you get to this stage, then you download the PDF and you realize there was a mistake and you want to make some amendment. Is that possible?
Thank you, Chief. Yes, please, it's possible. So this one, the beautiful thing is that whatever you are doing is saved in the browser history. So it always be available for you to go and do the amendment and then you can re-download. But if you go and clear your browser history, you may lose that data. You may have to start from scratch. But I mean, it's always available in the browser history. on your local storage history on the browser. So you can go and make amends once you don't clear your browser history. Please, Chief, is it okay? Hello, Chief.
Thank you.
Chief, are you okay?
I'm all right. Thank you.
Thank you so much.
All right.
Thank you so much. Yes. Yes, so thanks so much. And the availability is assured. We will continuously be available. Email will be available should we have any further questions or further thoughts on the matter. And I think, as promised, we will not extend the time, and we will just go ahead and then just close. However, we will just have a few remarks. In fact, he's actually on his meeting. He has to be gone for another meeting, but he'll give us a few remarks.
So, thanks so much, Dr. Gilbo. I've been called for another meeting, so I'm on the way go. On behalf of the Director General, I want to thank all of us for taking part in this very important meeting. There are two things now on the table. First one is conducting the regulatory survey on cardiometabolic medicines within the country. And like we said earlier on, we expect all regions to give it their optimum best. It's so important because for us, we have to justify the confidence that the service has placed in us. The second issue is our upcoming half-year performance review meeting. This year, we are going to focus, this first half, we are going to focus on two essential things. The first being expired medicines at our regions, and the second being management of NOP medicines that has been supplied to the regions under the Ghana Primary Healthcare Investment Program. So we are going to share the reporting or the presentation format with us in the course of time for the half-year review meeting. And we're also going to come up with a date that we feel will be convenient so that we can have that meeting done, put our data together, and also organize ourselves for upcoming headquarters performance review meeting. On that note, I thank all of us for making time to participate in this very, very important orientation meeting. I wish all of us a fruitful day and also a fruitful week. Thank you.
Thank you very much, Director. We really appreciate it. Thank you very much once again, all of us, for participating, and we hope we will engage together more. God bless us all, and let's have a good rest of week. Thank you very much, and see you another time. Meeting adjourned. Bye-bye.
Bye-bye.